Medigap insurance. What is it? And more importantly, do you need it? That's what we'll talk about today, so stay tuned. Hi, I'm Stephanie Apt. I am an independent Medicare broker, and I help seniors all over the country to navigate the world of Medicare. Today, I'm going to break down the basics of Medigap insurance. We're going to talk about what exactly Medigap is and what it covers. We'll talk about the costs of Medigap insurance. We'll review how to determine if you need Medigap insurance, and also when is the best time to enroll in Medigap. Medigap is Medicare Supplement insurance that's designed to fill in the gaps in original Medicare. And these are insurance plans sold by private insurance companies. They're designed to supplement your original Medicare benefits. Medicare isn't free, unfortunately, and it doesn't cover 100% of your healthcare services. Original Medicare will pay for some, but not all of your medical bills. So Medicare Supplement insurance, which is also known as Medigap, those two terms are synonymous, is designed to help you pay for the co-pays, coinsurance, deductibles, and out-of-pocket costs that original Medicare just doesn't cover. Let's talk a little bit about what these out-of-pocket costs consist of. Original Medicare is made up of Part A and Part B. And Part A is your hospital insurance designed to help cover inpatient hospital stays. Part B is your medical insurance designed to cover doctor's office visits and all outpatient medical services. With Medicare Part A, if you have an inpatient hospital stay, Medicare Part A will cover you, but you will still have some out-of-pocket that you're responsible for. Medicare Part A has a deductible of $1,408 for an inpatient hospital stay. And this deductible is per 60-day benefit period. So that deductible is not an annual deductible. It resets every 60-day benefit period. What that means is that if you go into the hospital, you have to pay the first $1,408 before Medicare Part A kicks in. After that, Medicare Part A will cover the next 60 days in the hospital. But if you're in the hospital longer than 60 days, you will have to start paying $352 per day. And if you're in the hospital longer than 90 days, you'll have to start paying $704 per day for your inpatient stay. Similarly, if you are in a skilled nursing facility, Medicare will cover your first 20 days in the skilled nursing facility, but after that, you will be responsible for $176 per day in a skilled nursing facility. Medicare Part B is your medical, outpatient, and doctor coverage. And this is potentially where you could see the biggest out-of-pocket exposure under original Medicare. Part B has a deductible of $198 per year. So you have to pay the first $198 of any of your Part B doctor, outpatient, and medical expenses. After that, Medicare kicks in, but it only kicks in at 80%, and you still have to pay the rest, 20%. And there is no cap on that 20%. So you will have to pay the full 20% for things like doctor's office visits, testing, MRIs, CAT scans, chemotherapy, all types of Medicare Part B services. This is where Medigap or Medicare Supplement insurance comes in. Original Medicare pays first, and then your Medigap plan pays second, and it picks up the remainder, the cost share, coinsurance, deductibles, and all of those out-of-pocket things that aren't covered by original Medicare A and B. And because original Medicare is still your primary insurance, with a Medigap plan, you can continue to go to any doctor that takes original Medicare benefits anywhere in the country. And it doesn't matter what Medigap plan you have or what insurance company you have your Medigap plan through. There are 10 standardized Medigap plans that you see on the screen right now, And to make it even trickier, as of January 1st, 2020, Medigap plans are no longer allowed to cover the Medicare Part B deductible. And if you remember, we said that Medicare Part B has a deductible of $198 per year. So if you are a new Medicare beneficiary as of January 1st, 2020, which means you turned 65, became eligible for A and B on or after January 1st, 2020, then you can no longer purchase Plan C or Plan F, which these were the two plans that used to cover the Medicare Part B deductible. If you turned 65, became eligible for Medicare before January 1st, 2020, then Plan C and Plan F are still available to you. Not all Medigap insurance carriers have to offer all of these plans, and many of the carriers only offer a few of them. The most popular Medicare Supplement plans that we see people going with today are Plan G and Plan N. These plans are offered very widely, and generally they have the best value for the cost. With Medigap Plan G, you have 100% coverage after the Medicare Part B deductible. So you have to pay the Medicare Part B deductible, that $198 deductible per year. But after that, you have coverage for all of your hospital stays, doctor's office visits, outpatient procedures. All of that is covered at 100%. So what does Medigap cost? In most parts of the country, premiums for Plan G for a 65-year-old range from about $80 a month up to about $130 a month. Of course, that depends on where you're located. And other Medigap plans like Plan N, which have slightly fewer benefits, have even lower premiums than that. When comparing these plans, it's very important to remember that they are standardized by plan letter. So the benefits of a Plan G with one company are the same exact benefits as Plan G with any other company. There's literally no difference at all. The only thing different usually is the premium, because different companies can charge you different prices for that same exact plan. So this is where working with an independent broker can really help you. We shop the market for you, so we can tell you all of the different prices for any given plan with any of the given insurance carriers offering that plan. This takes the legwork out of the equation for you, so you can easily find and shop Medigap plan prices, and our service is 100% free of charge. So when is the best time to enroll in Medigap? Many folks are surprised to find that there is no annual enrollment period for Medigap insurance. When it comes to Medigap, in most states, you get only one chance to enroll in Medigap insurance without medical underwriting. And this is when you are first turning 65 or you are adding Medicare Part B for the first time. After that one-time window closes, you generally will have to go through medical underwriting in order to qualify for a Medigap plan. And depending on your health, the insurance company could deny you coverage. So this one-time open enrollment window, when you first turn 65 or you first add Medicare Part B, is definitely the best time to apply for Medigap insurance, because you can pick any plan with any company. It's guaranteed to be approved for you at the preferred rate, regardless of your health. So the important question, do you need Medigap? A study in 2016 showed that of folks on original Medicare, 81% had some type of supplemental coverage. And when you look at the out-of-pocket costs associated with original Medicare, especially that 20% for all Medicare Part B services, that there's no cap on that, it definitely makes sense to look into some type of supplemental coverage to help cap your out-of-pocket exposure. Now, it's important to know that Medigap, or Medicare Supplement insurance, is different than Medicare Advantage. These two are not the same thing. Medicare Advantage plans are alternatives to original Medicare, and many of these plans are very low cost, have a $0 per month premium. I'm going to link a video in the description below that has some more information about Medicare Advantage plans, including pros and cons, so that you can look into those and see if they would be a good fit for your needs and your budget. Medigap Plans offer some of the most comprehensive coverage out there, really, and the most provider freedom. Sometimes we get calls from our clients that maybe have had Medigap for a while. They signed up when they were first turning 65 and they were really healthy and they've never had to use their plan, and something unexpected happens and they get cancer. And we get a call from them because they want to know, am I covered? How does my coverage work? And they're feeling a lot of stress and anxiety, of course. And in that moment, it always gives me, just a small piece to be able to offer them a little bit of relief in telling them, yes, you have 100% coverage. You are not going to have to pay for that hospital stay, for that chemotherapy, for that cancer treatment. And like I said, Medigap is a great fit for many. For others, there are some different options. So we are going to link some more resources below. Whether it's Medigap or Medicare Advantage, we are here to help you figure out which type of plan is going to be the best for you, for your needs, and for your budget. If you would like completely free, no obligation quotes, please feel free to reach out to us. We are licensed and work in most every state nationwide, and I would love the opportunity to assist. Thank you so much for watching. Please feel free to leave your comments below. We'd love to hear what you have to say. We'll see you soon.